have a colleague that worked close to me, and she has been working with lasers since the 90s. And she got a Fotona laser, and she called me and said, "You have to try this." So I went to her place, I tried it, and I bought one. Then I started with a Fotona Fidelis 3D, and then I upgraded to Lightwalker because I just loved it. I think it's very easy to use. I like the thought of 2 wavelengths, so I can switch easily when I need to. I like the pre-programmed applications that makes my life very easy when I use the laser, which I do every day.
When I learned more about the laser physics, when I learned more about the applications in everyday practice, I realized that Fotona provides me with the supreme possibility of settings. So this is not the product which actually gives you an opportunity to do something which is already preset. This is a product which actually gives you an opportunity to play, to develop your therapy approach, to find some new approaches. So this is not a laser device. This is like a moving laboratory, which really works perfectly in the hands of someone who wants to play the game. And I chose perfection, let's say.
Every application is used with the laser is more comfortable to the patient. So when I'm focused on implantology, my patients really appreciate the fact that I'm able to do immediate implantation. And for me, the best-selling application is immediate implantation. Very often, when the tooth is fractured and you have to extract the root, there is a granulation soft tissue. With the laser, I'm able to clean it thoroughly. I can disinfect the bone, so it's quite safe and predictable to do immediate implantation. It's very important when you are talking about aesthetic zone, when our patient expect immediate loading from the aesthetic reason, and then with the laser we are able to do this procedure with immediate smile, immediate loading, and the patient is finally satisfied.
Just have to tell the patient that using the laser in most of our applications is less tools, so less infection transfer, or less more hygienic than the other methods, because I just don't use a lancet or blah blah blah, or whatever the tools we are using. So the laser is really more hygienic than other applications or other tools.
The Lightwalker eliminates the need for the drill, and in most cases, of course, and also eliminates the need for giving anesthetic. And look, I know my patients feel very happy when I talk to them about applying the laser in other dental modalities like the perio and root canals and all that. But where I get the most excitement from them is actually when I do fillings with a laser and I can actually numb the teeth with a laser. And that has been one of the best-selling treatment applications for me, because even though I didn't do any external marketing and we just sort of like educated our patients about it, these people, once they received the first treatment and I did the fillings with a laser or numbed their teeth, I mean, I've done crown preparations without anesthetic, just purely numbing them with the laser, because these people were just really, really scared of needles. And they couldn't believe it. So they went out there and, spread the word for me.
When a patient comes to us from a business perspective, he wants a hassle-free work. He wants a dentistry that can last for a longer time, and that can, we can help our patient. We can take a holistic approach. So my from business point of view, I want to do, or I'm doing a lot of class 5 conservative approaches. For example, if a patient comes for an implant exposure, if somebody has placed the implant, I think so I can help that patient with erbium yak laser by not doing a second stage of surgery. So the best business model I produce in front of a patient is that whenever the patient comes to us, I always offer a drugless, a sutureless, a drillless, and a barberless dentistry so that we always have an upper hand. Plus, we always take a holistic approach. This is what we tell to a patient, that it's not the cutting or a conservation. We always are responsible or taking care of a healing part also. So this is what business model I give to the patient, and this is how I'm generating my patient, that we are taking a holistic approach.
I feel the more we can provide information for the patients about what the laser is, what it does, and the advantages and benefits, I think the more patients are interested in the treatments. It can be anything, from crown lengthening to depigmentation, from periodontal treatment, which can be a big issue for many patients, to snoring. I think if you just look at the business perspective, adding on what you are not already doing is probably the best option. Like if you're not doing any facial aesthetics, you start doing that with our Lightwalker. I think that's a big change. For me, it's been snoring, because I wasn't into sleep medicine, sleep dentistry a few years back. The more I learn about it, I think the happier I am, both as a practitioner, as how I can help the patients, and also business-wise. Return of investment is quite straightforward with the Lightwalker, because with any kind of treatment we have big advantages, and it's easy for the patients to understand what they are. They are happy to have those treatments.
For example, here in Beirut, in the Middle East, we do a lot of laser-assisted tooth bleaching. So with the touch white method, when using the erbium YAG laser energy, I'm now comfortable, because I don't need anymore to have a specific gel bleaching to use. Plus it is a very safe, very efficient, non-invasive technique due to the short application time of the product, so no sensitivity, no over bleaching. So I'm very happy. And also for the gingival depigmentation, very popular technique here in the Middle East. Well, with the laser, we can do it without having to do anesthesia. We don't need any periodontal dressing to cover the connective tissue. We don't need any antibiotics, any painkiller. Laser-assisted pathogen reduction, incisional hemostasis, and photobiomodulation, when we work with laser, will all interfere with the inflammatory reaction, and consequently the healing following laser surgery will appear more comfortable to the patient. I think there is no one best application. All are marvelous applications when I'm using my Lightwalker.
We must study the theory and practice of dental laser in different ways. Only in this way can we use laser correctly and regularly, make it as an effective assistant in our dental practice.
I would really like to emphasize our personal contact. So throughout the social networks, throughout the Facebook groups that we have, throughout the personal contacts which I have with practitioners, with lecturers, I would say that this kind of exchange of information is something which really helps me out to educate myself at a daily basis the most.
The education had to be continuous, because sharing the experience with the multiple users around the world. I'm a member in the Fotona site. I registered with the senior number of my device, and I watch a lot of the videos of the continuous education videos you present at your site on the Fotona. Also, I have downloaded the Fotona app on my mobile. It's really useful to know the experience of the other users all around the world.
The best way to maintain the laser skills and professional development is actually to use laser. If you use it, then you know what you can get out of the laser, of course. But you need to have some theoretical knowledge, which you can get, which we got in the Laser and Health Academy. First I went to some courses I've heard, then I bought myself a laser because I knew that the laser is future of the dentistry, at least in supportive side, and then you need to use it.
I did a conference 2 days ago and they asked me what I was practicing. I said 10 years ago, I said that I was practicing perio and implantology with lasers, and now I say I'm practicing lasers through periodontology and implantology.
Getting out of my comfort zone with new technology and being committed to continuous education and being ready and willing to adapt to changes in workflow to address changing times are key to professional development. The best decision I've made was to enroll myself for the mastership program of LAHA. It's a comprehensive program that has enlightened my confidence in treating patients.
Lots of literature have been published, so for sure I think Fotona themselves, the company, will be able to give you all the important scientific articles that you can follow up with, and you get to see some of these and practice and use this in your practice and achieve the success.
Personally, what I like the most is attending the annual LAHA symposiums. You know, I'm simply a light walker user, so this is a great opportunity for me to exchange practical and clinical ideas and skills related to the Fotona technology. And you know, there is always more to learn.